Welcome to the Birth Suites at Monash Health. My name is Tracy and I'm a midwife. Each hospital has its own birth suites that can all look a bit different. This is a standard birth suite room. We encourage women to make the room as comfortable for themselves as possible. Feel free to bring your own music to create a relaxed environment. Remember that this is your space while you are here. Each room has an electric birthing bed. Most of these beds can be changed into many different positions. If you prefer, and it's safe to do so, the bed can be moved to the side and a mat and/or birth ball or beanbag can be used. Every room has an ensuite bathroom with shower and toilet. There is a deep bath available in most birth suites if you wish to soak in the water to soothe and help ease the pain. Casey and Monash Clayton have baths suitable for water birth. If you are interested in this, speak to your midwife and read the water immersion and water birth fact sheet. When you arrive at the hospital, a midwife will assess and care for you. The expertise of a midwife is in caring for women with normal, healthy pregnancy, labour and birth. If you have a complicated pregnancy, labour or health problems, you will also have doctors involved in your care, performing procedures or operations if these are needed. This machine is called a resuscitator. It has the instruments and equipment for your baby should he or she require help when born. There are also other supplies in each room to assist with the safe birth of your baby. During your labour, it is important to make sure your baby is well. If you are well and your pregnancy has been normal, we will check your baby by simply listening to the heart rate every half an hour using a handheld Doppler ultrasound, similar to what is used during your pregnancy visits. If you or your baby have complications or may be likely to experience problems, then the baby's heart rate may be monitored by a machine called a cardiotachograph or CTG. This machine will give a continuous record of your baby's heart rate, allowing your baby's health and well-being to be monitored closely. We would also use one of these machines if you have an induction of labour, an epidural anaesthetic, or if you were in early labour and are returning home. This piece of equipment delivers nitrous oxide, which is the most common medical method of pain relief in labour. Nitrous oxide helps you concentrate on relaxing breathing techniques and can reduce discomfort at the peak of a contraction. It can make you feel a little sick and lightheaded, but it is a good pain relief option with no known lasting side effects to mum or baby. The birth suites also have other options of pain relief available, which will be discussed in another video. You can use a variety of positions during your labour and birth. These include standing, walking, lying on your side, kneeling, leaning on your support person or on a beanbag, using a birth ball or squatting. Your midwife may suggest that you try different positions as labour progresses. This will help your baby get into a good position for birth, using gravity to assist and promote progress in labour. We generally suggest you plan to have no more than 3 support people come in with you for labour. It is important that your support people know and accept your wishes and preferences. They need to be available to give you support, encouragement and reassurance. Please remember that if children are present, they must have an extra adult responsible for their care. You will stay in the birth suite for a couple of hours following the birth of your baby. During this time, the midwives will keep a close eye on you and your baby, making sure that your baby is adapting well to life outside your uterus. His or her temperature is normal and that your bleeding is not excessive. You may require stitches to your perineum if you have had an episiotomy, which is a cut or a tear. You will later be moved to a postnatal bed. Most women stay in hospital 1 or 2 days after a vaginal birth and around 3 days after a caesarean section. You'll be ready to go home if you and your baby are well, you can feed your baby or have a feeding plan, you can bath your baby and change his or her nappy, you can provide basic parenting care for your baby, and your discharge plan has been discussed with you. Your stay can of course be much shorter if all is well and you have support at home. One of our midwives will then visit you at home and check on you and your baby. If you are having your baby at Monash Health, we look forward to the privilege of sharing in your experience.